I am Dr. Raghuram. I am a Paediatric Haematologist at Aster group of hospitals. I look after children with blood problems and cancer problems, and we also do a bone marrow transplant for various disorders. Coming to cancers in children is very rare, but still some of the children do get cancer and they need specialized treatment. There can be three kinds of treatment for cancer. One is surgery, the second is chemotherapy, and in rare cases we may use radiotherapy as well. I am a doctor who gives chemotherapy for children with cancer, and the commonest cancer in children is leukemia. Most of them are treated just with chemotherapy, and most of them get better and do well. The second most common cancer is lymphoma. Again, these are treated with chemotherapy and most of them do well even in advanced stages. And the third commonest cancer is the brain tumors, brain and spine tumors. They are treated with a combination of surgery, some cases radiotherapy and chemotherapy. In general, most of the children's cancers, the children do well, unlike other cancers in older people. The other cancers are what we call solid tumors, which can present with lumps or tumor masses, mostly in the sometimes in the abdomen or in the kidneys, which we call the commonest being Wilms tumor, and they are treated with a combination of surgery, chemotherapy, and rarely sometimes radiotherapy. And the neuroblastoma again is treated with the same combination of the three elements of the cancer treatment. And the other cancers which we treat are called soft tissue tumors, the commonest being rhabdomyosarcoma. These present as lumps or bumps anywhere in the body. And again, this will need surgery and chemotherapy, and in rare occasions, radiotherapy as well. And we also treat bone tumors. Most of the times, these bone tumors are treated initially with surgery followed by chemotherapy. And in many of the occasions, in most situations, we do limb sparing surgery, follow it up with chemotherapy. We also do bone marrow transplant for children with various disorders. The commonest thing which we do the bone marrow transplant is for a disease called thalassemia and sickle cell anemia, where the children's blood is breaking down and sometimes they may need repeated blood transfusions, or they will have other problems like pain in various parts of the body, and the bone marrow transplant can completely cure them. We also do bone marrow transplant for some malignancies where when there is a relapsed leukemia, where the leukemia has been treated with chemotherapy and it has come back, or we do bone marrow transplant for some inborn errors of metabolism where the children are born with problems in their immunity or problems in their metabolism. These diseases also can be treated with bone marrow transplant. We work at Aster Hospital, which can cater to all these problems, and there's a comprehensive care where all modalities of treatment is available under one roof, and which is supported by various pediatric subspecialties, including intensive care and various other specialties.